Hey everyone, it's me, Jessie. Today we're going to talk about systemic lupus erythematosus, otherwise known as SLE. SLE is a chronic autoimmune disorder that causes inflammation in the body. It affects everyone individually and symptoms differ person to person. This makes diagnosis a difficult and lengthy process. It is known as the disease of 1,000 faces because it is a multisystemic disorder that can affect the integumentary, musculoskeletal, nervous, cardiovascular, respiratory, urinary, and reproductive systems. SLE does not mean the immune system is weak. Rather, it is overactive or abnormally active. The immune system can't tell the difference between foreign invaders and body's healthy tissues and then creates autoantibodies that attack and destroy those healthy tissues. There's no known cause of SLE, but evidence shows that genetics, certain drug exposure, emotional upset, injury, infection, stress, or overexposure to sunlight may contribute to developing the disease. SLE can look like a variety of different diseases, with many different signs and symptoms. Therefore, for a diagnosis, a person must have at least 4 of the following: debilitating fatigue, mental confusion, cognitive dysfunction, or short-term memory loss, alopecia, malar rash, discoid skin rash, photosensitivity, mucous membrane ulcers, arthritis in more than 2 joints, pleurisy or pericarditis, kidney problems, brain irritation, blood count abnormalities, immunologic disorders, anti-nuclear antibodies in the blood. Depending on what systems are affected, the signs and symptoms experienced will change, but some that are most common include fatigue, fever, joint pain, stiffness or swelling, butterfly rash, skin lesions, Raynaud's phenomenon, shortness of breath, chest pain, dry eyes, headaches, confusion, or memory loss. Now let's look at those symptoms and signs a little closer and from a massage therapist's perspective. Fatigue. Massage may have to be shortened as to not cause more fatigue. Fever. With an elevated temperature, massage of any form is contraindicated. Joint pain, stiffness, and swelling. Massage can be beneficial in reducing pain and stiffness, but swollen joints can be due to a flare-up and should be avoided. Butterfly rash. Rash that covers the cheeks and bridge of the nose. It's not contagious, so doesn't change or affect your massage. Skin lesions, which are worsened with sun exposure, aka photosensitivity, can occur anywhere on the body, and massage would be locally contraindicated. Raynaud's phenomenon. Massage can help to increase the circulation, and hydrotherapy, warm baths, and paraffin baths could be beneficial. Shortness of breath and chest pain. The length of massage may need to be altered because pleurisy or inflammation in fluid could be in lungs causing these symptoms, so communication with client is very important to stay up to date. Dry eyes. There is no real effect on your massage treatment. Headaches, confusion, and memory loss. Massage can help to reduce the pain that is experienced with a headache. Lupus comes in waves called flares, which are periods when signs and symptoms get worse, and then they'll improve or disappear, and this cycle just keeps repeating itself. These flares are brought on by triggers, such as excessive ultraviolet light exposure, emotional stress, injury, infection, trauma, or pregnancy. Because SLE affects everyone so differently, there are various ways to approach this condition treatment-wise. As of right now, there is no cure for lupus, so the main goal is to reduce inflammation and maintain healthy organ function.
Created using Powtoon.